Welcome. I am Terry Tropin, and today I am presenting a lesson on CPT coding for skin lesions. First, let me introduce myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. Also, I'm an AHIMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines using real English rather than bureaucratic jargon. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external causes. These are available on Amazon. This video will discuss treatments for benign and malignant lesions of the skin. Now, a lesion is defined as any abnormal or altered tissue, a wound, a cyst, an abscess, a boil, birthmark, any kind of thing like that. So I'm going to talk about benign skin lesions, excision and destruction, and malignant skin lesions, excision and destruction. These codes are very confusing because they use different approaches to coding. The codes may be selected by the number of lesions treated, the size of the lesion treated, the location of the lesion, or the type of repair performed to close the defect. Sometimes they use combinations of these two factors. So this is what I'm going to discuss. Benign and malignant lesions will be discussed separately. To select the correct code, these are the questions you need to ask. How was the lesion treated? How are the codes selected? How do you code treatment for different lesions? And do you need a modifier? Let's start with benign lesions. Benign lesions include neoplasms, which any benign new growth, non-cancerous new growth, cicatrix, a thickened scar tissue, an inflammatory lesion, meaning it's red and swollen, and congenital lesions, like birthmarks, and cystic lesions, which are sacs of fluid. These codes specifically exclude skin tags. Skin tags are coded using codes 11200 to 11201, so they have a separate section all to themselves. Benign lesions can be treated by either excision or destruction. We will discuss these separately. For excision, the lesion is treated using full thickness excision, which goes through the dermis, the layer of skin under the outer epidermis. So it's full thickness through the dermis. Includes removal of margins, the area around the lesion, which I'm going to talk about more in a minute. Simple closure, which means suture involving only the epidermis or the dermis. And it also includes local anesthesia. The correct codes are selected by the location of the lesion and by its side. Each lesion is coded separately. The locations are in groups, such as trunk, arms, legs, scalp, necks, hands, feet, genitalia, face, ears, eyelids, nose, lips, and mucous membrane. First, find the appropriate group of areas of skin, then find the size of the lesion. That will be the correct code. So a 1.1 centimeter lesion in the arm would be coded as 11402, while a 1.1 centimeter lesion in the nose, on the nose, would be coded as 11442. So it depends on two factors. Where is it? How big is it? The measurement used to select a code does not include only the size of the lesion. It also includes the margins. This is the area around the lesion that are also removed with the lesion itself. So in this picture, the lesion is in red, and that's 0.5 centimeters. The margin around the lesion is the circumference through the circle. 0.2 centimeters on one side, 0.2 centimeters on the other side, a total of 4. So you have 0.2, 0.5, and 0.2, which is 9. So you use a code for the group for face. This is a lesion of the nose. So you use a code from the group for face, ears, eyelids, nose, lips, and mucous membranes, which are 11440, 11446, and then the code for the size, the 0.9, not the 0.5 for just the lesion, but the total lesion plus the area around it, which has also been removed. So how do you code if you have multiple coded separately? Okay, so if you have 2, even if it's in one area, you still do one separate for each one. If more than one lesion is being reported, code the most extensive, the biggest excision first, and then the other code or codes with the modifier 51, which the modifier 51 indicates multiple procedures. So here is a practice. If you wish to code this on your own, pause the video. Excision of 0.9 centimeter benign lesion on the penis. The correct code is determined by the location and size of the lesion. So find excision, lesion, skin, benign, which refers you to the codes in the main part of the book. You see codes group for scalp, knee, skin of scalp, neck, hands, feet, genitalia is the correct group. And within that group, you want a 0.9 centimeters, so it's 11421. Now note, if you looked up excision penis, you will refer to a different set of codes in the male genitalia system, a whole different procedure. So be careful, make sure you look up excision, lesion, skin. Very important. There are separate codes for excision of hidradenitis, another type of benign lesion. These are small, painful bumps that form under the skin. They may be in the axillary, the inguinal, perianal, perineal, or umbilical areas. So this is treated with excision of the skin and subcutaneous tissue. So how are these codes selected? These codes are selected by the location and type of repair used on the skin after the excision. You can't use this, you don't use this by the number of lesions. As you can see from this picture, they're very small, they're all grouped together. It will be very difficult to do it that way. So where are they located? Well, there's different codes if it's in the armpit, the groin, or the other areas. And it's also determined by the type of repair. This is the only one of these codes that is determined by type of repair. If it's axillary, simple, or intermediate, it's 11450, complex, axillary, 11451, inguinal, simple or intermediate, 11462, complex, 11463, and others, simple and complex. A simple or intermediate repair is single or multiple repairs. A complex is, the definitions in CPT are not all that clear, but it's more than just multiple layers. It's more complex than that. So how are multiple multiple lesions coded? If several areas are treated and or different repairs are used, code separately. So you have one for the area, but if there's different areas, like one in the armpit, one in the groin, then you're going to code them separately. Do you need a modifier? If you have separate areas coded, yes, you'll need a modifier 51, multiple procedures. So before we move on to destructions of lesions, let me talk a little bit about the difference between excision and destruction. Excision, you cut off a lesion, or the lesion is removed by the physician, and it can be sent to the pathologist for examination. A destroyed lesion means there's nothing left. There's no tissue to send to the pathologist. This is like a laser or chemical destruction. So excision, destruction, these often get confused. So let's look at destruction. Destruction codes for this are for benign lesions still. 17000, 17250. Condylomata, papillomata, molluscum contagiosum, herpes lesions, warts, milia, and keratoses. So there are different sets of codes for different kinds of destruction of benign lesions. There's premalignant, and this is 17000, 17004, vascular proliferative lesions, other benign lesions, and granulation tissues. So knowing that it's destruction of benign is not enough. You have to know what type of benign lesion it is. So how are these treated? Destruction includes electrocautery, using electric current, cryosurgery, using cold, laser, or chemicals. The codes say with or without currentment, scraping, includes anesthesia, and usually does not require closure. So let's start with benign premalignant lesions. This is destruction of these is coded 17000, 17004. These are abnormal tissues that are not now cancerous, but may become cancerous over time. So they're just going to take them off now. An example is a keratosis. These codes are selected by the number of lesions. Note that the location of the lesion is not a factor. It's just numbers. They could be anywhere. So you have 17000 destruction premalignant lesions, first lesion, and then you have an add-on code 17003 second through 14 lesions each. So you code these for each of the additional lesions up to 14. If it's 15 or more lesions, you code 17004. So that's kind of confusing. If reporting 12 lesions, for example, report 17000 for the first lesion plus 17003 times 11 for lesions 2 to 12. Okay, so you count up, make sure you have the right number. You got 12. You got 1 for 17000, and that leaves you 11, 17003 times 11. Now, on the other hand, if you're reporting 17 lesions, which is 15 or more, you're going to report only 17004. Only the one code. So that's a little tricky. Do you need a modifier? No. Since this uses an add-on code, you're not going to use a modifier 51. And if it's more than 15, if it's 15 or more, you're going to do only 17004, and that's any number 15 or more. So you're not going to use a modifier for these. Vascular proliferative lesions are another type of benign lesions. These are an area of abnormal blood vessels in the skin, such as a port wine birthmark. So how are these codes selected? Well, they're all in destruction of proliferative lesions are in 17106, 17108, a separate section from the previous ones. And this is by the size of the treated area. You have 17106, which is less than 10 square centimeters, 17107, 10.0 to 50.0, it's a big range, and then 17108, over 50.0 square centimeters. So for example, if you're reporting 25 lesions that is 25.0 square centimeters, you're going to report only 17107, that's 10 to 50, 25 falls in that area. So for these lesions, you're going to list one code for one treatment area. Obviously, you can't see that there are multiple, maybe multiple blood vessels involved. There's really no multiple lesions that you can code separately. Now, in the unlikely event that there's more than one area treated, you can report separate areas, separate codes for each area by the size, and the largest area first, and then the second area with a modifier 51. Then there's a category for other benign lesions. It's 17110, 17110, 17111. These are other than skin tags, premalignant, or proliferative lesions. So how are these coded? These are coded by the number of lesions. Note that these codes do not indicate a location. Okay. You have 1110, destruction of benign lesions up to 14, and then 17114, 15 or more. So what if you have multiple lesions? Well, the multiple is kind of included in the codes themselves, up to 14, 14 or less, and then 15 or more. Do you need a modifier? No. You're going to list one code for the total number of lesions treated. For example, destruction of 16 benign lesions, report 17111, which is for 15 or more only. So no modifiers on these. There's one more type of benign lesion we're going to talk about. This is granulation tissue. Granulation tissue, sometimes called proud flesh, is coded with this one code, 17250. This is when a wound is healing. As the wound fills in with new tissue, the wound may go beyond the tissue may go beyond the skin level, so it's above the skin level. That's what I call proud. So don't use this code, 17250, if you're also coding for removal of the lesion, the same lesion. If it's you don't do it to report cauterization to achieve wound hemostasis, and with codes for wound care. So how are these codes selected? Well, this is easy. There's only one code, 17250. How are multiple granulation wounds reported? Again, this is unlikely, but you can do it ×2 or 3 or whatever if appropriate. Do you need a modifier? No. So let's do another practice. Again, stop it. Pause the video if you want to code it on your own. Physician destroyed 12 premalignant lesions on the patient's trunk. The correct code in this case is determined by the number of lesions, separate codes for each lesions. So you're going to use 17000, 17003 times 11. You have 12 lesions. Note that 17003 says each. So each separate lesion is reported separately. So let's move on to malignant lesions. These also can be treated using either excision or destruction. So what's an example? Well, basal cell carcinoma, squamous cell carcinoma, melanoma. These are coded as malignant lesions. So how is this treated? Well, its excision is a full thickness excision through the dermis, and then removal of the margins. So we'll talk a little bit more about margins again. It includes simple closure, suture of the wound involving only the epidermis or the dermis, and again includes local anesthesia. So margins. So coding for excision includes margins in the measurements. The measurements, the good tissue that's taken in addition to the lesion itself. So here's an example. Again, we're going to talk about a lesion on the nose. The lesion itself is 0.9 centimeters. The margins around the lesions are 0.6 centimeters, 0.3 and 0.3. You notice you're taking it from the widest area around the lesion. So you have 0.9 for the lesion plus 0.3, 0.3, that equals 1.5. So you're going to use code 11642 in the face, ears, eyelids, nose, lips section which includes 1.1 to 2.0. Since this is 1.5, that falls into that category. So how are these codes selected? Well, they're coded according to size. Remember the lesion plus the margin. So you have the locations in group, trunk, arms or legs, scalp, necks, hands, feet, genitalia, face, ears, eyelids, nose, lips. These are the same groups used for benign lesions, except that mucous membranes are not included with the group for face, ears, eyelids, nose, and lips. The sizes are also the same. So to find a code for excision of a 2.5 centimeter malignant lesion of the foot, refer to the group scalp, neck, hands, feet, genitalia, and to collect code 11623, which includes 2.1 to 3.0, and the 2.5 lesion would fall into that category. So how are multiple lesions reported? Code each lesion separately. Report the most extensive lesion, the biggest or deepest or most troublesome one first, and then a modifier 51 on additional lesions. Here's a practice for malignant lesions. If you want to pause the video, you can do so now. Basal cell carcinoma on the skin of the forehead and right arm. So excision of lesion on the forehead is 1.4 centimeters. Excuse me. Excision of lesion of the skin of the arm is 2.1 centimeters. So the correct code is determined by size and location. So you're going to do 11642 for, whoop, that's wrong. 11642 for the forehead, 11603 for the arm. Why do you not put the RT on there? Well, because you don't have a right skin and a left skin. You have a right arm and a left arm, but you have skin, remember, is one whole body system. So in the CPT Index, find excision, skin, lesion, malignant. This refers you to codes 11600, 11646. Look at the main part of the CPT book. The forehead is included in the face. Okay, so 11642 is in the group for face, ears, eyelids, nose, and lips. 11603 is in the group for trunk, arms, and legs. So let's look at destruction of malignant lesions. Destruction may be done by laser surgery, electrosurgery, cryosurgery, chemosurgery, and surgical curement. So how are codes selected? Again, by size and location. The categories are the same as the previous ones, as are the sizes. You can see that mucous membrane is back in the face, ears, eyelids, nose, lips section. So if a malignant lesion of the lip measuring 4.1 centimeters is destroyed, use a code from the group 17280 and select code 17286. It's 4.1 centimeters, so it would come into that category. Each lesion is coded separately. Code the largest, most complex one first, with additional codes for the others with modifier 51. Using the index, be careful doing this. Be sure to look up excision skin, then benign or malignant, destruction skin, then benign, malignant, or premalignant, or lesion skin, then destruction or excision. So here's an example of where this can put you off. Excision, skin of abdomen, benign lesion, that's what we're looking for. So if in the index you look up excision abdomen, you're referred to codes in the digestive system section, 49203 to 4205. These are codes for excision of tumors, cysts, or endometriomas, not the skin. On the other hand, if you look up excision skin benign, you're referred to codes for skin lesions. Notes to make in your CPT group. Remember, we talked about the different ways that codes are selected. So make notes in your book about how to select it. You can abbreviate these notes listed here because this is kind of wordy, but it will make it much easier to code if the selection process is spelled out. You don't have to go back to the paragraph. You don't have to think about how am I supposed to do this. So next to 11400, 11446, code each lesion separately by size plus margins, modifier 51 if needed. 11450, 11471, modifier 51 if different areas or repairs are used. So this is size and margins, modifier 51, and this is modifier 51 only if different areas are different repairs. 11600, 11640, size and margins, modifier 51. 17000, 17004, in groups 1 to 4 and more than 14, 1 to 14 and more than 14. You're going to report these this way. This is, I think, is one of the trickier ones, so make a note there on that one. 17106, 17108, report one code for total size of treated area and modifier 51 of different treatment areas. This is not size, this is area. 17110, 17111, one code for total number of lesions. 17260, 17286, each lesion separately by size plus margins, and a modifier 51 if needed. It is also easy to get into the wrong grouping of areas. So my suggestion is to take each area and circle it to keep all the codes, the main code that has the areas and then the size codes indented under it together. So draw a circle around 11400, 11406 to say this is a unit. 1160, 11626, this is another unit. 17260, 17266, this is a separate grouping, and this keeps them all together. You might also underline the different types of destruction in the benign lesion codes. Premalignant, specifically in the code. If you have it underlined, you notice it right away. Vascular proliferative codes and the granulation tissue. In the CPT Index, you might circle excision skin. So go to the excision section and circle skin. So that way that helps you remember to go to skin rather than the body part. Destruction skin, lesion skin. This completes this lesson. If you have questions or comments, please feel free to contact me. Here's how to contact me up here. Here are also the books I've written on coding. These are available on Amazon. You can use this link or go to Amazon Books and type in my last name, Tropin, T-R-O-P-I-N. And click on the picture, on my picture in the upper right-hand corner to subscribe to my channel. I'm posting a new video about once a week, so don't miss out. Thank you so much for listening. I hope to have more lessons up soon. Thank you.